I am Bernard Dan, Editor-in-Chief of Developmental Medicine and Child Neurology. I recently wrote an editorial on the very early diagnosis of autism, and today I'm having a conversation about it with Professor Tony Charman, who is the Chair in Clinical Child Psychology at the Institute of Psychiatry, Psychology and Neuroscience at King's College in London. Tony is a member of our editorial board and he's been an expert on autism in general, in many aspects. Tony, thank you for doing this with us. What is early diagnosis of autism?
Early diagnosis usually refers to children who are given a diagnosis in the preschool years.
Many parents and professionals would find this to be quite late. Would it be possible to make a diagnosis earlier?
I think it brings up several issues. One of them would be the sort of accuracy and the reliability of a diagnosis made very much earlier than a child's second birthday. Another issue, of course, in many communities is what follows on from that in terms of are there services, what do we know about very early intervention. I think that's something in which we are making some sort of progress, and I think certainly some individuals who are diagnosing children sometimes as young as 18 months of age. I'm a bit more sceptical about whether diagnosis much earlier, for example around the first birthday, is necessarily going to be feasible or practicable.
Is it otherwise useful to recognize clinical signs before a diagnosis of autism can be reliably made?
I think lots of neurodevelopmental services should be aiming to identify children who are struggling and just are falling behind in some sort of way, giving that a name. If you're sure it's autism and we know enough about whether that autism is going to continue to look like a relevant presentation, may be sort of informative, but it may be at an early age that actually we need to unlock the provision of services from specific diagnosis.
Thus focus on the needs rather than a label. How do you deal with this in the clinic when you meet families?
Sometimes in the clinic we talk about the notion of a working diagnosis. So you talk about presentations that maybe you sometimes see in very young children with autism, but they can be presentations you see in very young children who also have developmental language problems who won't end up meeting the criteria for autism.
We know there can be variations in services. Are cultural differences also important?
I think that's an interesting question, and I think it's something we definitely don't know enough about. And at least in many studies, sometimes there's a bias against low-income and minority ethnic communities accessing both research studies, but also potentially accessing services. I think it's also a very difficult topic to study well, partly because if there are inherent biases, either in clinical services, which may be less accessible to individuals from minorities or different cultures, or if some of the instruments and conventional designs that we use in our research study, because they're being developed mostly on people from particular communities, maybe they're not actually picking up some aspects that are there. Ideally, you'd be doing whole population studies that have mixed populations.
In the editorial, I mentioned a number of red flags that we may identify in very young children. How would you suggest we use them?
Well, I think that notion of red flags has been incredibly helpful, partly because they can be something that can be used to train and educate clinicians and even nursery nurses and even the general public, and they can be presented in quite an accessible way. So those sorts of things about having poorer joint attention and having reduced amounts of gestures or poorer imitation skills are things that can be shown, and you can have pictures and you can have video clips, and there are libraries of these clips that clinicians and indeed the community can access. The problem is that you can't access those sorts of things and then tot up to a simple sort of total to say once you get to a score of 10 out of 20, that means it's very likely that your child has autism, because things in clinical practice are always much more complex than that. And of course the presentation is very different because autism is such a broad spectrum with a very high degree of variability. So not everyone will have the same cluster of symptoms at any particular age.
What do we know about very early intervention?
That's been interesting in that there now are a couple of trials that have been run and have reported, ours and one from the United States, that have been doing parent-mediated interventions with 9 to 10-month-olds who are at family risk of autism.
Well, this is important. I hope you get good results, because the level of expectation is very high and families receive messages that are not always accurate.
I think sometimes there's messages that somehow if autism is missed or if a child isn't diagnosed until they get to school, that can be a very negative message for parents because they feel that they've missed the boat and that the opportunity's gone, which I don't think there's any evidence for.
Well, thank you. Thank you very much, Tony.